afternoon and welcome to the Mesa Chamber of Commerce Inside Business Podcast. My name is Sally Harrison. I'm President and CEO of the Mesa Chamber of Commerce, and today we're in the University of Phoenix podcast studio. I've got a little introduction because we have kind of a really important subject today. As a national leader in integrated healthcare services, Encompass Health offers both facility-based and home-based patient care through its network of inpatient rehabilitation hospitals, home health agencies, and hospice agencies. With a national footprint that includes 134 hospitals, 245 home health locations, and 83 hospice locations in 37 states and Puerto Rico, the company is committed to delivering high-quality, cost-effective, integrated healthcare across the healthcare continuum. Encompass Health is ranked as one of the Fortune 100 best companies to work for. Congratulations on that. That's awesome. Here in Mesa, Encompass Health Rehabilitation Hospital of the East Valley is a 70-bed inpatient rehabilitation hospital that offers comprehensive inpatient services. Encompass Health East Valley is accredited by the Joint Commission and has disease-specific certifications for amputee, brain injury, Parkinson's disease, and stroke rehabilitation. Serving patients throughout the East Valley, the hospital is located at 5652 East Baseline Road, and you can learn more about them at encompasshealth.com/East Valley Rehab. So it is March and it is National Brain Injury Awareness Month, and today we're lucky to have friends Rachel Branks, who is a certified rehabilitation registered nurse with a master's in science and nursing, and Teresa Beckman, who is a physical therapist with a doctorate of physical therapy and is also a board certified neurological. You guys have like the longest titles ever, clinical specialist, and they're here to talk about the who's and what of traumatic brain injury or TBI. So let's talk about that, ladies. Tell us what traumatic brain injury or a TBI, what is that?
So if you go by CDC definition, it's kind of a long one. They talk about, disrupting normal function of the brain, and really we're looking at anything caused externally. So a bump, a hit, a jolt, anything that kind of penetrates or goes into the head. It's really any physical injury that changes how your brain works.
Okay. Well, you hear a lot about that when you're talking about veterans or, police officers. So I think TBI a little more well-known as far as, people hearing the term. They may not always understand it, but I think a lot of us have heard it now. So who's at risk for getting a TBI?
Well, really anyone is at risk for getting a TBI. Anyone can get a TBI in a car accident. Anyone can fall down and hit their head, falling down the stairs. However, there are three main age groups that are the highest risk for TBI. The first one is infants and toddlers ages 0 to 4. And this is the age when babies are at risk for rolling off the bed or falling off the couch onto the floor. And then as they get a little bit older, they start to walk and they can fall down and hit their head when they're walking. And unfortunately, this age group is also at risk for abusive head trauma, which is formerly known as shaken baby syndrome. This form of abuse occurs when somebody shakes a baby or hits a baby against a hard surface. This ties into one of the biggest risk factors for TBI in children, which is abuse. Non-accidental trauma is the cause of at least 80% of deaths in head trauma in children under 2, and approximately 2/3 of children under 3 who are physically abused have some form of traumatic brain injury. The second age group are adolescents and young adults ages 15 to 24. This age group is when we see teenagers. They start driving. And because their frontal lobes are not completely developed at this age, they're not making the greatest decisions. They're texting and driving, they're speeding, they're racing, they're not wearing their seatbelts. They're riding motorcycles and dirt bikes and four-wheelers. And they're getting into contact sports like football, wrestling, hockey. And all of these things put them at a huge risk for getting a TBI. Lastly, in this age group, like you mentioned earlier, it is associated with the military, combat, blast, explosives, and firearms. And the last age group is older adults, ages 65 and above. And this is directly related to falling. As we age, our balance worsens, and many older adults develop orthostatic hypotension. When your blood pressure drops, when you sit up and stand up too quickly, It can make you dizzy, and you can even pass out, and you can fall and hit your head.
Oh. Well, what can we do to decrease the risk of a TBI?
So and it varies with kind of the age group and the reason. So in our younger kids, it's really taking a lot of like child-proofing precautions, things like helmets, when we're, riding the bikes and the scooters, that helps with kind of the accident and the fall part of it. Supervision is a big thing, especially when you look at, just kind of watching kids, how they're getting around the house, especially as they're getting mobile. I've got 3 young kids, including 2 toddlers. It's not always easy. So, that alone can feel like a full-time job.
Sure.
When you get into the abusive head trauma, like the we said, formerly known as shaken baby, that one's a little more complex because that one introduces a lot of social issues, as far as, sometimes it's a matter of, maybe do we need to increase our support network for parents and caregivers, so that when they have stressors, or other situations for like mental health, that they have access to resources to help decrease these kids as being kind of the outlet for that. And then, there's also the complicated situations that occur with abusive households, and finding, places for shelters for women to get out of abusive relationships is unfortunately one of the higher statistics for that. Because a lot of times it's not even the primary parent. It's like it's a boyfriend or a girlfriend or somebody who's a caregiver, but not necessarily directly family.
Okay.
When you get into, oh yeah, go ahead. What?
No, I'm just listening, learning.
And then when you get into our young adults, a lot of it is still like kind of safety preventative stuff. It's wearing the seatbelt, it's wearing the helmets and things like that when you go out and do the contact sports. And I think sport safety and activity safety, and even when you talk about like military, I think we've made a lot of really great advancements in the equipment and the technology that we use to keep people safe. I think one of the things that I know a lot of personal people in my life are always surprised to learn is a lot of helmets for motorcycles and bicycles are only good for one impact. They're a lot like car seats that way. After one impact, one major incident, you need to get a new helmet, because the materials that are designed to kind of absorb the impact, and after they've absorbed one impact, they've done their job, so they need to be retired, and a new one needs to be used. I know a lot of people, like, oh, this helmet's got me through 3 accidents. It really probably shouldn't have. Each time it provides less and less protection. So, replacing helmets and things like that, making sure that they're in good condition. I know some of the sport helmets are designed to be multiple use, and so that's really kind of a manufacturer dependent thing. The other thing that really comes into play is really just, helping support our youth and our adults in having, good adults so that they can talk to and relate to kind of help them avoid any kind of drug and alcohol use. Because a lot of the motor vehicle accidents and things like that happen have a high rate of drugs or other alcohol things being on board. And it's funny because you'll sometimes hear people talk about, oh, like, well, at least I was, like if you think like with drinking with our like younger 20 somethings, it's like, oh, I was drunk, so I was relaxed. But actually having the alcohol or the drugs on board makes your brain more vulnerable to injury. Absolutely. And can actually make what may have been a mild injury much worse. Yes. So it's kind of like, oh no, actually that didn't help you.
Right.
And then in our 65 plus group, Rachel mentioned a lot about how balance and some other, normal aging changes can happen. And one of the things that really surprised me when I first started as a physical therapist, and Rachel, I don't know if you can say the same for nursing, is how many people thought that they just have to deal with the balance changes and some of that stuff as they age. Like, well, I'm getting older and this is just part of it and there's nothing I can do. And I'm like, no, actually there's a lot you can do. So that really pulls at my physical therapy heartstrings. So what we know is that, as like the Nat King Cole song goes, kids from age 1 to 92 is, at all ages, we know that balance and strength training can really help people. And then, Rachel can maybe talk this more, but, the fancy word is polypharmacy. But when you get on a lot of different medications, and this includes natural supplements too, they can have interactions, and that can affect your balance and your dizziness and regular visits with either your pharmacist or your primary care doctor, someone who can help you look at these things on a regular basis and say, you know, has my situation changed? Do I still need all of these? You know,
Right.
sometimes you'd be surprised that the answer is no, you can cut back. Or maybe we can change the timings. You're not getting so many different ones at once. Or, you know, maybe you do need all of them at those times, but we can look at what symptoms you're having and then try to work on alternative ways to help you deal with them. So that way, even if you do have to have those symptoms, you're not necessarily left to fend with them on your own.
Mhm.
Yeah, absolutely. There's so many medications that older adults are on that put them at a huge risk for falling, whether it's a blood pressure medication, a pain medication. Really, there's so many that are a quote fall risk medication. And when you have an older adult, maybe in their 70s or 80s, who take a handful of pills every single day, they're at a huge risk for falling, and they don't even know it. They think they're perfectly fine. As you said, I'm getting older. There's not a whole lot I can do about it. It's just the way it is. That's not true. There's a lot you can do to prevent a fall as you're getting older.
Right. Yeah, I'm sure a lot of people think it's just a supplement. It's not going to, play into the other drugs or, prescription drugs that you're on, but it all does play a part, I'm sure. Talk about what the most common type of a TBI is.
So TBIs can be broken down into 3 different categories: mild, moderate, and severe. And the most common type of TBI are mild TBIs, which is good. In fact, 75% of TBIs that occur each year in the US are considered to be mild TBIs. A mild TBI can have either a brief or no loss of consciousness, and its presentation can demonstrate with vomiting, lethargy, dizziness, inability to recall what just happened. And we see this most often in our sports, our football players, boxers, wrestlers, MMA fighters, other contact sports. And unfortunately, the issue with mild TBIs is those symptoms don't always present right away. Sometimes it's weeks or months after.
Really?
And that's what makes it very difficult to diagnose a mild TBI, is because you either overlook it as something else or it's misdiagnosed, and you never know that you have a mild TBI.
Interesting. So talk about then the flip side of concussion. What does that look like?
So this is kind of a trick question because a concussion is actually a type of mild TBI.
Mhm.
And so I think recognizing that, one of the things that, when we educate people is, well, it's a concussion. So I think in some ways, when we talk about TBIs, it's a very personal diagnosis because it can feel like your brain is very personal. And so I think sometimes when we say concussion, it's almost getting brushed under the rug a little bit.
Mhm.
And it's used to kind of downplay, what can be a very serious issue still. Because when we talk about it as a mild TBI, just like what we talked about earlier, it's still a traumatic cause. And it's metabolic rather than physical damage. And what I mean by that is our bodies have like chemical and electrical signals. And so concussions are oftentimes harder to diagnose because there aren't physical things to see. But you're still getting changes because the brain has changed the way it's communicating, even though there's nothing physical that's changed.
Got it.
And they can still have the same symptoms as the mild TBI that you talked about. It can affect your sleep. It can make you feel dizzy or off balance. Sometimes it might just be like if you're already prone to being car sick, like your car sickness suddenly increases, but you don't really know why. Or if you're already prone to migraines, all of a sudden your migraines have this uptick, but you can't really point your finger to what happened. And they can go away in a day or hours, but they could also last weeks or months, just like other mild TBIs. So I think this is one of those things where it was kind of a trick question because really it's just a subtype. It's just a subtype of a mild TBI. And so I think, but we say concussion and then it's kind of like, oh, well, that's not a big deal, but it really can be.
It is a big deal.
Sure. Well, what are some common myths about concussion?
I think there's 3 that are kind of like my top 3 myths. People will say, well, it wasn't a concussion because I didn't pass out. I didn't lose consciousness. but that's actually not required. You can have a concussion and be alert and awake the whole time. The other one is, especially in our setting, we get people after they've been to a major hospital in most cases, and they'll tell me, well, all of my scans were normal. There were no changes on my MRI or my CT scan. And that's also another myth. You don't have to have changes on the scan. The scans can be negative, but like we talked about earlier, it's not a physical change. It's the change at the level of like a cellular structure. So it wouldn't show on those scans. And then the third one is just that like if it's a concussion, then it'll go away in a couple of days. And that's not always the case. A lot of times, like she said, you don't realize it right away. And it's like, you'll be doing something leisurely and, you're out doing, weekend softball and you're having fun and you're relaxed and you don't really notice it. And then it's not until you go back to work on Monday and all of a sudden you're in the office or you're at work and it's, the busy time when all the customers are coming in and all of a sudden you just feel like things are getting jumbled. And for whatever reason, you just feel off that day. And so it's not until you have a lot of stressors or demands on your brain at the same time that you really start to notice that something is off.
Okay, interesting. I know some people have like my son fell and got a concussion and he was very nauseous. It seems like that's probably, I don't know, the one I hear most, that and you get tired and not let people fall asleep.
Yes. Yeah. I think, the not falling asleep thing or not letting them sleep right away is because you want to monitor them. But once you're at the initial phase, actually rest is one of the best things to make sure your brain is getting time to heal. So, once you've sought your medical help and they've kind of cleared you through like the initial phase of it, rest actually becomes a very important factor in recovery from all brain injuries.
Yes. Good to know. So how do you treat a TBI?
Well, treatment of a TBI depends on the individual, and it also depends on the severity of the brain injury. Like Teresa said, rest and slow resumption of normal activities, as long as those symptoms are not reoccurring, is the best treatment. Treatment should be symptom-based, including treating any sleep disturbances, headaches, fatigue, dizziness, sensory sensitivity, nausea, vomiting. Those are all great to treat for mild TBIs. And also for moderate to severe TBIs, inpatient rehabilitation, like we do here at Encompass, is most beneficial. And that includes physical therapy, occupational therapy, and speech therapy. Treatment should be symptom focused based off careful diagnosis. It should emphasize both functional resolution and compensatory strategies. And it should provide an optimistic outlook and clear path for patient to improve. The overall goal of treating a TBI is getting the person back to the highest and safest level of independence possible.
Got it. How long does a TBI last? I'm sure it varies.
Yeah, as I say, that's another it depends question. So a lot of times if your concussions and your mild TBIs, you will see them clear and most people can return to everything they were doing before, with maybe only minor things that they have to monitor or watch out for. For people in the moderate or severe injury types, I think that's where you look at, this really does become a lifelong game of routine and management, depending on where they are. Because with, moderate and even with severe, depending on where in the brain they were affected, they can sometimes still move and walk around and even talk semi-normally, and you wouldn't maybe pick up on it right away, and so in that case, I think that's probably almost the hardest situation, because you have somebody who maybe appears very normal on the outside, despite the fact that their brain really has been affected in a way that prevents them from communicating normally or having normal social interactions. I think that's probably the highest risk group. And so then it really becomes a game of patterning your day and being on a routine and being on a schedule. And then even in a case where the TBI, can have impacts similar to stroke, where you start to lose function in a limb or an arm or not speak well, at that point in time, you're looking at, how do you set up with your support team? A lot of times that's the family or a spouse, ways to support this person so they can still kind of function on a daily basis. So it's lifelong. And then with good management, you can get into routines, and that takes care of a lot of things, but it's still a lot of support.
Yeah, absolutely.
All right. Well, talk about things that make it TBI difficult to diagnose and treat.
Well, like Teresa said, one of the most difficult things about treating someone with a TBI is a lot of times you have no idea that a person has a TBI. 5.3 million Americans are currently disabled with a TBI in the United States. And a majority of those people are not hospitalized or institutionalized. They're walking around alongside us every single day, and they look just like you and I do, but their brains are functioning completely differently. The symptoms are often mild and unrecognizable. For example, my husband sustained a TBI in the Marine Corps 10 years ago, and you would never know it. He looks and acts perfectly fine. He can hold a perfect conversation. No one would ever know that his brain functions a little bit differently than everybody else's. But he can tell, and these people that are close to him can tell that he struggles with short-term memory, problem solving, multitasking is very difficult for him, but he's learned a lot of compensatory mechanisms and ways to work around his injury. Many head injuries also go undiagnosed because they're invisible to begin with and not being taken seriously on top of that. Many symptoms, like we said, don't show up for weeks or sometimes months after the injury, and the symptoms are very vague. They can mimic other symptoms, like you could think it's just a migraine, or I'm just nauseous, maybe I ate something bad, or they're very non-specific. So that makes it very difficult to diagnose and treat a TBI. The key to diagnosing and treating even mild TBIs and concussions is early intervention. Don't shake it off or try to walk it off and say, oh, I'm fine, I just hit my head, I'm okay. Whether you played a sport, or if you fell, or if you stood up and bumped your head into something or backed up into something, get it checked out, even if you think you're fine. Even mild TBIs can have long-lasting effects.
You say the stand up and hit your head. I can't tell you how many times I've done that, and you don't even think about it. But if you bump it on the trunk lid, you just you don't think about some of those things that actually could have like that longer lasting effect on people. And well, gosh,
to tag off of that, a lot of times we'll find people, if they've been in like major vehicle accidents, is probably a really common one. They've gotten a lot of other injuries, like maybe they had a neck injury and a fracture here, and they've got a leg fracture at the same time. And so they're on a lot of medications for that. And so sometimes, they're feeling foggy and groggy because they're on all these heavy pain meds. And so it's not even until they're clearing off those pain meds that you can even really start to see that something else is going on.
Sure.
So it's almost like masked by other things that could occur at the same time for the more significant injuries.
Absolutely.
Yeah, that would be difficult. Well, do you have anything else you want to cover?
The only other thing that I could think of was when you're talking about these little bumps, we talk about recovery and kind of things like that. One of the things that sometimes they say to watch out for when you're recovering is it's called second impact syndrome. And so when you're recovering from one brain injury, sometimes something as small as a minor bump, like, on that cupboard, I know it's the overhead cupboards in the kitchen that I always get. Where it's like the car door when I'm like coming out after buckling my kids in the seatbelt. So sometimes even a minor bump like those, when your brain is still in this very like early recovery stage, can cause what they call second impact syndrome, which can take even a mild brain injury into the severe, because you're on kind of layering two injuries on top of each other.
Well, thank you for being on our podcast today and for putting Brain Injury Awareness Month in front of people, because I think all of us at some point have had some bump or something ourselves, or we've dealt with family members or loved ones, friends, colleagues that have gone through some kind of TBI or concussion. And it is important for us to talk about and recognize that there are issues like this out there. So thank you. And hopefully we'll see you guys again on another podcast talking about another topic. But for now, I just want to say thanks. And you can find all of our episodes of the Inside Business Podcast at iTunes, Google Play, YouTube, or your own favorite podcast website, or you can find them online at mesachamber.org. Thanks again. Stay connected to Mesa Chamber social media, email newsletters, Monday morning message, and mesachamber.org to always know what's happening at your Mesa Chamber.